Hello guys. So now we shall be discussing regarding the head of the pancreas. So especially we shall be discussing regarding the anterior relations of the head of the pancreas. Okay. So topic of discussion would be the anterior relations of head of pancreas. So what are the structures? What do you mean by anterior relations of head of pancreas? It means what are the structures that are located anterior to the head of the pancreas. Okay. So let us draw a picture over here and then see. First of all, you should know where is the head of the pancreas located. Head of the pancreas, if this is the head of the pancreas, it is located in the loop of the duodenum, the C-shaped loop. Okay. So let us say this is the loop of the duodenum. So within this loop of the duodenum, the head of the pancreas is located. Okay. So let us draw the head of the pancreas over here. Let us say this is the head of the pancreas, and yeah, this is the tail of the pancreas, and all of you know we have got an uncinate process like this. Okay, so this is the head of the pancreas and this is the tail of the pancreas, and this is the uncinate process. Now let us see what are the structures that are located in front of the head of the pancreas. Head of the pancreas, in the sense it is all the way from here till here, right? So this yellow color part which I'm shading right now is your head of the pancreas. So let us see what are the structures that are located in the head of the pancreas. Right. So the first important structure, guys, the first important structure is that there is an artery. Okay, there is an artery that is coming on the top of this. Okay, so you see an artery that is coming on the top like this, right? So what is the name of this artery which is passing over the top of the head of the pancreas? This is called as superior mesenteric artery. So when I tell superior mesenteric artery, there should also be a vein just nearer to it, right? So this vein which is coming just adjacent to the superior mesenteric artery is called as superior mesenteric vein. So these two are passing on the uncinate process. Uncinate process is present on the head only. So it is passing over the head of the pancreas. Next important thing. Next important thing is that all of you know that here we have got ascending colon. Okay. So this is the ascending colon over here. Now after this ascending colon, here we have got the transverse colon. You see this part is called as the transverse colon. So if I rub out this area over here, you can very clearly visualize that the transverse colon is also the part which is passing in front of the head of the pancreas, isn't it? So if you look at this picture right now, yeah, now what you can see here, you can see that the transverse colon is passing on the surface, I mean on the head of the pancreas, in front of the head of the pancreas. Okay, now after that, here there is a fold of mesentery that is coming all the way like this. So let me draw it with green. Yeah, so there is a fold of mesentery that is going all the way till here like this. Okay, so this fold of mesentery which you can see, which I am representing with the dotted lines over here, this fold of mesentery is called as transverse mesocolon. So previous lectures of peritoneum, I told you what is transverse mesocolon, right? So this is transverse mesocolon. So let us write down all the things now. So first important thing, right? So what is the first important thing over here, guys? Yes, what is the first important thing? Here we have got what? The first important thing is the transverse colon. Transverse colon. Second important thing is this one is your superior mesenteric artery. Okay, and the third important thing, this one over here, this would be your superior mesenteric vein. Superior mesenteric vein, superior mesenteric artery, superior mesenteric vein. And this part, obviously not to forget that this is the fourth part, and this is called here as your transverse mesocolon. Transverse mesocolon. And one last part is there. Now what is that last part is that here this is a duodenum, right? Duodenum will continue as what? Duodenum will continue as jejunum. See, this is the duodenum, right? So duodenum is continuing as jejunum like this. So as it is continuing like jejunum, and then you have got your ileum, and then you have got your cecum. So this is the ileum that is attached to the cecum. Let us say This part over here is your cecum. So this part all the way till here is your jejunum. Now you can see here very clearly, right? So exactly I'm zooming this part. You can see that this line is touching the head of the pancreas, right? So it means jejunum is passing in front of the head of the pancreas, right? So the fourth important thing which I would like to mention here is that, so this part over here, that is a fifth important thing, that is a jejunum. So if someone asks you what are the different parts that are crossing, what are the different parts that are related to the anterior part of the head of the pancreas, the first important thing is your transverse colon, next superior mesenteric artery and superior mesenteric vein. Okay, next you have got the transverse colon as well as the jejunum. So all these structures which I have just mentioned you are the structures which are covering your anterior surface or passing from the anterior surface of the head of the pancreas. Okay, so this is all you need to know regarding the surfaces here, anterior relations. So thank you so much for watching my video. Goodbye.